Okay, I'm going to talk a little bit about the exercise program that I have designed for patients with long COVID dysautonomia, and I'm hoping that it will also help patients with chronic fatigue syndrome. The idea of the exercise program is to allow patients to slowly return to prior levels of physical activity and day-to-day activity. It'll also hopefully encourage patients who haven't been exercising before to form a lifestyle physical activity habit. The challenge in this exercise program is going to be allowing patients to exercise consistently while at the same time avoiding post-exertional malaise. There are three components to the exercise program. The first is short duration of exercise. Now, when you are exercising, the temptation may be there to exercise for longer than the prescribed amount of time. And whilst this is positive in terms of the mindset and motivation for exercise, it may lead to a negative experience of the exercise. And this is because the longer you exercise, the more products of exercise metabolism you will accumulate, and the longer you will take to recover from the exercise session. So in this exercise program, the sessions will start with a very short duration, between 3 and 5 minutes. The next component of the exercise program is adequate recovery in between sessions. So when you are exercising and you exercise prior to having fully recovered, you may also have a negative experience of that exercise session. You can judge your own recovery based on how you're feeling when you get up in the morning, but you could also base it on your heart rate variability, which you can measure day to day, and I have another video explaining how to do this. In athletes, adequate recovery from exercise is a well-recognized component of their training regimen, and this is because if they don't adequately recover, then they are likely to affect their performance in a negative manner, and this is referred to as overtraining. Now, obviously this may present a challenge for patients, as some patients, I'm sure, feel like they are never not tired, and they may be thinking, well, I'll never feel like I haven't recovered from exercise. But I think if you were adhering to the exercise program with very short durations of exercise, you might find over time that you're more recovered than you were expecting. The general rule of thumb will be to try not to go more than 2 days without any physical activity. The third component of the exercise program is that it will start in the horizontal position. The reason for this is that standing up causes a stress on the autonomic nervous system, and often patients with a disorder of the autonomic nervous system will find standing for long periods of time quite difficult. This is because it is the autonomic nervous system that adjusts your heart rate and your blood pressure and your blood distribution to the upright posture. So if you eliminate the upright posture at the start of the exercise program, you will then be eliminating an added stress, and this may allow you to get more out of each exercise session.